in Royal Oak, and giving us some good information about the overall Beaumont program. Being the chief of Beaumont Troy, tell us a little about what patients can expect when they come to Beaumont Troy, and when they specifically come for back care.
Well, the Spine and Wellness Center at Beaumont Hospital in Troy is designed to offer a patient-friendly, unique and integrated full-service approach to the treatment of back and neck disorders. We recognize that patients have a variety of problems with their backs and necks, and therefore we try to offer a variety of treatments. We try and make it a place where the patients can come in, be evaluated, obtain diagnostic studies if they need it, and then get started on a course of treatment that helps them to get better in a timely fashion.
I think this is
One of the things that I have found very enlightening, surprising almost, is that when we come with a back problem to an orthopedic doctor, we are not necessarily going to have surgery recommended. That's what a lot of people think, and that isn't the case all the time.
No, and in fact, it's very rare to come in with acute onset of back pain, even some chronic problems, and actually end up having a surgical consultation.
What are some of the non-surgical treatments that you can offer for patients to do?
Well, the first thing we tell people is that, look, there's a good chance that if you're part of the 80% of the population that gets back pain, that you're going to get over it without needing much of anything. So the first thing we tell them is have some time to rest. And then if the symptoms persist more than about 24 hours, then they should give a call and be evaluated by the doctors. The primary route is bed rest or medication for the first 24 hours, and then gradually increase activity to get back to normal. We have them come in if the pain persists longer than that time.
Okay, so that explains why when I called with some ankle pain that I was having, and I was referred from my primary to the orthopedic specialist, he said, why don't you take some anti-inflammatories like Tylenol or something like that and just put your foot up for a day. Just don't go to work.
Exactly.
It went away.
Well, the mechanism of pain is the body finds something that works and it sticks with it. So the same pain fibers that work for your ankle are the same pain fibers that signal that your back's having a problem.
Let's talk about back pain in specific. Is there a difference? Lower back pain, middle back pain, upper back pain, and if so, what are the differences?
Well, I think that the first thing to understand is that the body is made of a series of neural pathways, and those pathways conduct impulses to the brain through the spinal cord. Back, neck, interscapular shoulder pain, they're all transmitted along the same fibers. The real diagnostic dilemma is figuring out where it's coming from and what the cause is in the body. Because pain, whether it be in the neck or back, the treatment is usually the same.
Is there any type of pain that you might have that would be more dangerous than another?
We certainly have recommendations for people that are having specific pain and for pain that lasts greater than about 72 hours.
Would you say that pain lower than the back might have something to do with the back? In other words, if somebody is experiencing pain down into what they might consider the buttocks area, that might be a real back pain.
Well, I think the best analogy to use, because everybody knows about it, is if you're having a heart attack and you have left arm pain, that's something to worry about. And so people that have pain in their arms, the first thing they think of in a certain age group is, is this a heart attack? Luckily, if you're having pain in your back, or down the leg, or in the shoulders and arms, we think of a pinched nerve.
Okay. Now, if I have some pain, and I've called you, and you say bed rest for a day or two, and I get back up and I don't have the pain, but then 2 days later I do have the pain, what I'm trying to get at is, when do I come in? When should I say, okay, it's time for me to go in?
Sure. I think that if you've given it a try and you've used anti-inflammatories and you've taken it easy for 24 hours and you're still having problems, you need to let us know. Particularly if you're experiencing any numbness in or having any difficulty moving any of your extremities. That's one of the things we want to see right away.
We're talking with Dr. Richard Easton. He is the Director of Spine Surgery at Beaumont Hospital, Troy. You'll notice we've been talking for quite a few minutes, and the subject of surgery hasn't come up. So we're going to stay in that vein, and let's say I hear a lot from the orthopedic people about exercise. How can exercise help in a case of back pain?
Exercise is just great for your body all the way around. And we've recognized that regular low-impact cardiovascular exercise that doesn't jar your back or cause you to have, and it's easy on your joints rather, such as bicycling, walking, and swimming, we found that the overall positive effects on your entire body are just unbelievable.
When you say walking,
We've found.
what kind of walking are you talking about? The kind that I do on my treadmill, which is about 3.6 miles per hour.
Oh, I love it.
It's pretty fast. Or, for me, or just ambling along.
No, certainly we want you to get your heart rate up, and we'd like for it to be something that you can have a normal conversation without being too short of breath, but we don't want it to be so slow that you can look around at the pictures on the wall as you're going. We want you to focus on your activity and get from one point to the other with a certain amount of speed.
Now, let's say that we've come to the point where we decide that we want to go in and start looking around, that we're not having much luck with the exercise, we're not having much luck with some of the other things, the bed rest and so forth. At what point do you start counseling toward surgery? And what kinds of things do you counsel for surgery?
Well, again, we certainly want to see the patients, first of all, if they feel they need to see us. We do, as you said, the first 24 hours of bed rest, anti-inflammatories, hot and cold packs. But we want to see you right away if there's the numbness or tingling, if you have any loss of bowel and bladder control, if you're having severe fevers and headaches. You know, those are the things that tend to signal nerve root impingement again, and things that aren't resolving on their own within 2 to 3 days, I would recommend an appointment with the physician.
Now, the lower back pain, when my father had it years ago, he just automatically assumed, well, I've got a problem with a disc. Was that a fair assumption on his part? I mean, he did have a problem with the disc, but I'm wondering if that self-diagnosis is true today.
I think that that's very true. A lot of times discs can cause low back pain. There's other structures in the back, such as the joints, the facet joints, and the actual nerves themselves that can be pinched or irritated that can cause the pain as well. But generally, if it's back pain, it's a disc causing the pain, or it's the facet joint that's giving some irritation in the area.
Can you tell us about this fitness center that Beaumont is working on for the near future?
Yeah, the fitness center at Beaumont Hospital is going to be a relatively unique setting.
Is that
It
the
will
one he's
allow
building?
patients a single point of entry
Dad?
into a program that helps them to coordinate their health, with emphasis being on
I'm gonna ask
weight
him about
management,
this.
diabetes and sugar control, control of hypertension, as well as overall fitness and care of the back and neck. It doesn't really exist anywhere right now, so I think it's a unique opportunity.
I was
for
going to
them.
ask, well, how does that differ from a normal athletic club?
Well, the athletic clubs don't have the access to the medical personnel. This building is also going to be occupied by a team of healthcare specialists that will take all comers. We take the phone call. We filter the patients to the appropriate service. We make sure that they get seen. We make sure that they get diagnosed. And then, most importantly, we start them on the treatment of their back or neck disorder or their health disorder that best fits them.
Are there any last words of advice that you could give to our listeners out there who either have back or neck pain or know someone who does?
Absolutely. I would tell patients to pay attention to their bodies. If they're feeling healthy, then I'd ask them to continue to work hard to keep themselves that way. If they have an injury or feel pain, follow some of the guidelines that you brought up
Probably
earlier
look
about
insane.
when to come in. And if the
Probably
pain
look
persists
insane.
or worsens in spite of appropriate care, contact your physician so that you can be seen.
And you should take all of these steps knowing that you're probably not going to wind up, even if you go to the orthopedic department, you're probably not going to wind up in surgery.
95% success rate with conservative care. So 95 out of 100 phone callers never need to see us.
Dr. Easton, thank you. You've been a wealth of information. It's been a real pleasure having you on the program. And most of all, thank you for listening to this edition of Orthopedics on the Leading Edge. Do you have a Beaumont doctor?
Right. Yeah.